Hi friends, welcome to videos by allornonelaw team. Thanks for watching this video. Please do give your feedbacks as it will help us to do better for you, and thanks for subscribing. If you look at the pictures on the slide, it is obvious that the central part of the image appears gray or distorted. This is what happens in age-related macular degeneration, that is AMD. AMD is the leading cause of visual impairment in developed countries like USA and UK. Cataract remains the most common cause in developing countries. Age is the most important risk factor for developing AMD. As age increases, the risk of AMD increases. It's commonly seen in people more than 65 years of age. Smoking is the most important risk factor. It's commonly seen in whites and Chinese as compared to black population. There is a lot of research going on to look for the genetic factors involved in development of AMD as it runs in families. The pathology in AMD lies at the level of retinal pigment epithelium, which is the outermost layer of the retina, and the Bruch's membrane, which is the part of the choroid. This is the normal disc. This is the macular area. This is the cross section of the retina showing all the 10 layers. This is retinal pigment epithelium. This is Bruch's membrane, and this is choroid. The image on the right side shows the retinal pigment epithelium, which is disrupted. There are some new blood vessels, choroidal neovascular membrane or CNV, Bruch's membrane, and the choroid. It presents with the painless loss of central vision. The classical presentation is painless loss of the central vision. The peripheral vision is perfectly normal. This is how you differentiate it from other causes for loss of vision, where the peripheral field of vision as well is affected. This loss of vision can be gradual or acute depending on the type, whether it is dry or wet type. The dry type presents with gradual loss of vision, which may take 5 to 10 years or sometimes even more, and most of the time patients are not aware that they have got dry AMD. Just opposite to this, wet AMD presents with sudden loss of vision, which can happen in a day or in a matter of few days. The yellow deposits around the macular area at the level of retinal pigment epithelium is the characteristic finding in dry AMD. These are called as drusen's. Wet AMD generally develops in people with dry type of AMD. The new blood vessels grow beneath the retina in the macular area, and it presents with sudden loss of vision, as we discussed. On examination, you can see some hemorrhage in the macular area, and sometimes you can see some fluid in the macular area. If this remains for a long time, it leads to scar at the macula, which causes irreversible loss of vision. How do we diagnose AMD? The dry type is detected on routine examination by the optician or by the ophthalmologist. It needs a dilated fundus examination to look for drusen's. It does not need any further investigations nor any treatment. The wet type needs further tests to confirm the diagnosis because the treatment is in the form of injections into the eye. The diagnosis is confirmed by doing the fluorescein angiography, which is basically a dye test. The Amsler grid you are seeing on the slide, the left side image shows what a normal person can see on the grid, whereas a patient with wet AMD sees the central area to be distorted. This test is not specific for AMD. Any pathology in macula can cause disturbance in this. OCT, the optical coherence tomography, it's nothing but a virtual cross-section of the retina. This represents all the 10 layers of the retina. This dip is called as fovea, which is the central part of the macula, and this red line represents the retinal pigment epithelium. The pathology in AMD lies at this retinal pigment epithelium. This image below shows that the red line is broken, that is, the RP is broken, and there are some black cysts or the pockets of fluid. This is fluid within the retina that we get in AMD. How do we treat AMD? It's important to explain to the patient that we can't cure AMD, but we can try to prevent the progression of AMD. The injection of anti-VEGF, that is vascular endothelium growth factor, ranibizumab or bevacizumab, are used only in wet AMD patients to stop progression. Other treatment modalities like photodynamic therapy, laser photocoagulation were used before, but they are not very effective. It's very important to reassure the patients that they will not go completely blind with AMD. Their peripheral vision is perfectly normal as mine and yours. Magnifying lenses, large prints for reading do help. Even using an iPad or any tablet for reading is a better idea, where you can change the brightness and the size of the prints. Vitamins and green leafy vegetables do help to improve the nutrition of the retina, and quitting the smoking does help. An interesting complication that you may come across in AMD patients is what is called as Charles Bonnet syndrome. It is characterized by visual hallucinations. It may take up to 12 to 18 months to settle. It's important to be aware of this, just to make sure that you don't treat these patients with some psychiatric treatment. If you are asked to choose between dry AMD and wet type, I'm sure you will choose dry AMD after listening to this. 90% of the AMD is dry type, and 90% of these remain dry type. It is characterized by gradual progressive loss of vision. Though there is no treatment for it, reassurance and visual aids like magnifiers do help. Thanks for listening for this video. Please do give your feedbacks on this presentation.